So wash my hands. Hi, my name is Hannah. I'm going to be your physical therapist today.
Hi.
How are you doing?
Good. How are you?
Good. So I'm going to start off with a measurement, some of your neck range of motion. I'm just going to grab the tool. So we're going to check your neck flexion. What that is, you're just going to bring your chin down to your chest as far as you can go, okay?
Okay.
There you go. What this is a goniometer. It's going to help me measure that range of motion to the degree.
Mm-hmm.
So I'm going to have you just straight ahead. And I'm going to put the fulcrum, which is the middle, over your ear. And then the top is going to be perpendicular to the floor, and the moving arm is going to be in line with the nose. So I'm just going to have you bend forward now. Bend your neck forward. Yep. Okay. Alright. So your neck flexion, weight right here, okay, is 50 degrees, which is within normal limits. Did you have any pain or uncomfort during that?
Yeah. So the back of my neck just feels like it's pulling.
Pulling on it? Okay, so you probably have some tightness in there. Now we're going to do something called the deep neck flexor endurance test. So I'm just going to test the endurance of some of your neck flexors. I'm going to have you lie down on your back. And your feet are going to be flat on the table. Your back, feet flat. Alright. So what this test is going to do is it's going to test the endurance of these deep neck flexors right in there. I'm going to have you do a chin tuck, so tuck your chin a little bit, yep. And then you're going to lift your head up and you're just going to hold it there for as long as you can, and I will time this. Alright, so that was 6 seconds, and the norms are normally about 29 seconds, so this can potentially contribute to your posture and that pain and discomfort that you're getting. So we're going to work on some deep neck flexor exercises in your first treatment. So now I'm going to do a test to see if you have any cervical instability. What I'm going to do is I'm just going to passively bring your chin to your chest and then rotate your head a little bit, okay? So I'm just going to pick up your head. Just relax. So I'm going to talk you through it so you know what I'm doing. So I'm just going to bend your neck up and I'm going to rotate it. Any discomfort with that? Okay, and then I would do the same to the other side. Both these tests were negative. Now we're going to do a cervical quadrant test. So that's going to consist of me. I'm going to extend your head, rotate it, and side bend it. And I want you to know if at any time you feel any discomfort or pain or even some radiating symptoms down your arm, just let me know, okay?
Okay.
Alright. Actually, I'm going to get this stool. Okay. So I'm just going to extend your head, rotate it, and then side bend it. Alright. Anything with that?
Nothing.
Nothing? Alright, so the test would be negative then. Great. So I wash my hands. Hi, my name's Hannah. I'm going to be your physical therapist today.
Hi.
How you doing?
Good. How are you?
Not too bad. So what we're going to do today is some things to help with your neck. And we're going to start off with some soft tissue mobilization to your upper traps right here.
Okay.
So I'm going to have you over there, sit on that chair.
All right.
And if you don't mind, can you take your shirt off?
No.
Alright, so I'm going to put some lotion on you. It might be a little cold, just to warn you. And we're going to start off with something called effleurage. It's a Swedish massage technique. And what it is just to get you used to my touch, to warm the muscles up a little bit. And I would do this for about 2 minutes just to get this warm. And then I would move on to petrissage. which is more deeper massage. Use the palm, hand like that. And just find any tight spots and really work that. I would do this bilaterally, so to both of your upper traps. Now we're going to do something called the suboccipital release. I'm going to lift up your head, find the bony landmark, the occiput, and then just bring my fingers out a little bit and find that spot. And now I'm just going to let gravity do the work. And you should feel some tension, but I just want you to relax your head. There you go. Relax your head into my hands. And what this is going to do for you is it's going to release some tension in those muscles. The first muscles that I'm going to feel are more superficial muscles, so the first layer of muscles. And then as you relax more, I'm going to feel those suboccipital muscles, which are really tight on you, which can be causing some of your headaches that you have been having. So you can close your eyes, relax, keep them open if you want. And depending on how tight that you are, this could take anywhere from 30 seconds to a few minutes. So I'm just going to hang out here a little bit. And then I could do this again, two to three times, or as long as it takes for those muscles to be released. So now we're going to do an exercise for your deep neck flexors. This is just a little chin tuck, and it's going to help correct some of that forward posture that you have. I'm going to have you lie down on your back. And this is just a small movement, so you don't want to over-engage these muscles in the front of your neck, okay? So if you want, you can put your fingers right on where your collarbones are, towards the middle, and then just a little bit up. So just so you can see if those muscles are more engaged. If you feel really big muscle popping out at you, that means you've gone too far, okay? So what you're going to do is tuck your chin a little bit, yep, and then you're just going to lift your head just about an inch up, okay? And then you're going to hold for 5 seconds up there, and then you're going to go back down. And you're going to do 2 sets of 10 of these.